after the session. They'll be time stamped, so all of the morning sessions, you should have already signed in. And as we move through the afternoon sessions, make sure that you sign in to those after the session, after the session, after the session. Brittney Carmichael with North Georgia Health District is going to do a quick Narcan training for us. Once again, these beautiful people, I've asked them to join us, and they've said no problem. And Brittney was the same. So Brittney, thank you so much for being here. I'm going to turn it over to you.
Thank you.
Thank you.
All right, is everybody ready for a nap now that we've all eaten lunch? All right, awesome. So I'm just going to do a brief naloxone. Hopefully it's a review for you all, and maybe there's some new information. I can always click through too.
It was working so good for us when we were doing it, right?
Okay.
There we go.
All right, so here's the training overview. We're going to go over what overdoses are looking like in Georgia, risk factors for opioid overdose, how to identify an opioid overdose, how to address an opioid overdose, and then I've got some naloxone resources for you, and then an FAQ, and if you all have any questions to follow up. So currently, overdose trends in Georgia have increased since the COVID-19 pandemic. I'm sure a lot of you all went through that kind of mental health fluctuation, and as did the rest of the world. And so a lot of people have been using substances to cope. Fentanyl is a key contributor, as well as polysubstance use, meaning that people are using more than one drug. And I'm not sure if you've heard, but xylazine or tranq dope is making Narcan responses more difficult because it's a non-opioid animal tranquilizer that's being added into fentanyl. So let's talk about who's at risk for an opioid overdose. Risk factors might include anybody who has a reduced tolerance. So for you all, that might be somebody who's entering into recovery. Their tolerance goes down, and then if they have a setback and they resume their normal use, they're gonna maybe potentially experience an overdose. Anybody who injects opioids or goes really fast with their substance use, anybody who has a legitimate prescription for opioids, particularly in higher doses, anyone who uses opioids in combination with other substances or that polysubstance use. Sometimes that might be for people who have underlying medical conditions like liver disease, HIV, and then any household where an opioid is present. All right, so how do we identify an opioid overdose? What does that look like? Really common symptoms that we see are cyanosis or hypoxia. It's blue fingertips, blue nails, blue lips. For anybody who has a deeper skin tone, that might come across as gray, but that's basically because of the respiratory depression that people are experiencing. Somebody might appear to be awake, but they can't talk. They may be unconscious, snoring, gurgling. Sometimes it's referred to as a death rattle. It's not normal breathing. It's also referred to as agonal. Sometimes the breathing might be shallow, slow, erratic pulse, and a limp posture. So how do we respond to an overdose? Naloxone, or more commonly known as Narcan. Narcan is a medication that is used to reverse opioid overdoses. The reversal effects begin within 2 to 3 minutes of administration, and they last anywhere from 30 to 90 minutes. Multiple doses is really common, especially for people who are using high doses of opioids. And if it's not an opioid overdose, it's not going to hurt somebody. However, if someone is opioid dependent, using naloxone to reverse an opioid overdose will send people into withdrawals. Well, I had this wonderful Narcan administration video for you, but it appears as if it's not going to play. So I will ad-lib for you guys. So if you notice that somebody is experiencing an opioid overdose or you suspect it, you're going to want to immediately call 911. If you've ever seen nasal Narcan, it looks a lot like any other nasal spray that you would use. So you would insert the tip into someone's nostril, you'd plunge the plunger. The only way you can do it wrong is if you're outside the nostril. You'll wait about 2 to 3 minutes. Responses are significant. You will notice that person regain their respirations. They will begin to become conscious again. If they do not produce any sort of reaction, then you'll want to go to the other nostril and do the other dose. In a box of Narcan, there's 2 doses. And so you'll use that second dose. But in the meantime, you'll want to see if that person's breathing. If they have not begun breathing, you'll want to administer rescue breathing, also known as CPR, but without the chest compressions. Although if you notice that there's no pulse, you want to give those cardio resuscitation as well. If that first dose does work, sit with the person, wait. The Narcan only lasts for 30 to 90 minutes, meaning that someone can re-overdose once those effects last, or wear off, I'm sorry. And like I said earlier, if someone's opioid dependent and you've just given them Narcan, it's very possible that they will go into withdrawal symptoms. One of those symptoms being vomiting. So you'll want to turn somebody over onto their side to make sure that they are not going to ingest any fluids that come up as a result. Another thing I wanted to share with y'all, and I hope you are familiar with, Georgia has a 911 medical amnesty law, which provides limited protections for people who have possession of small amounts or personal amounts of drugs. As long as they stay with the person who's overdosing. Essentially, they've recognized that people who do drugs oftentimes do drugs with other people who are doing drugs, and they just want people to call and stay and wait and get help. It also provides limited protections for anybody who's on probation, parole, pretrial release, or underage alcohol consumption. So Naloxone is available near you. The FDA approved it for over-the-counter sales, prescriptions not needed, and you can actually get it on Amazon or it's on the shelves at Walmart now. And I have a free Naloxone resource for you. I'm not sure if you're familiar, but Next Distro has partnered with the Georgia Harm Reduction Coalition. And you go on this website that I've linked here, and I can ask Todd to send it out to all of you. But you'll watch a video on all of the things that I told you, and it's probably a lot more concise and more professional. But you'll basically learn how to recognize and respond to an opioid overdose. You'll take a brief quiz on what you learned, and you'll provide your mailing address, and they'll send it to you in a discreet envelope right to your door. Some questions that sometimes people ask, does naloxone expire? Yes, typically it gets about 2 years of a shelf life, but there's extensive studies that show that it's good beyond that. Will naloxone hurt someone if they're not experiencing an opioid overdose? No, naloxone has very few, if any, side effects unless you're opioid dependent, in which case you would maybe go through withdrawal symptoms. Can you keep naloxone in your car? It's not recommended. The box says excursions up to 104 degrees. So you'll want to keep it in a dry and cool place. But if it was in your car once and it got hot, I would always use it. If that's what you have, that's the life-saving tool, and that's what's going to matter with somebody. And you guys are all in the business of recovery, and so the bottom line is that we need to keep people alive until they're ready to see you all, right? So Narcan is a super valuable tool. Does anybody have any questions for me? Yes, ma'am. Yes, and it will have the working video with it so you can have better instructions. All right, thank you all for your time. This is me, and my card is out that way. Thank you.